Diane Newman.
And I'm Benjamin Brucker.
In this series of brief videos, we'll debunk common myths about overactive bladder, or OAB, and its treatment.
Here, we'll focus on some of the clinical attributes of GEMTESA, a beta-3 adrenergic agonist indicated for the treatment of OAB with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults, and for the treatment of OAB with symptoms of urgency urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for BPH.
GEMTESA is contraindicated in patients with known hypersensitivity to Vibagram or any components of GEMTESA. Hypersensitivity reactions such as angioedema have occurred. Please see full important safety information at the end of this video. In my practice, it is common for patients, especially those who have previously tried OAB medication, to believe that if they've tried one OAB medication, they've tried them all. What would you say in response to that, Ben?
Well, as we know, there are two classes of pharmacologic medication, anticholinergics and beta-3 agonists, and they work quite differently. Anticholinergics bind to muscarinic receptors in the bladder to suppress detrusor muscle contractions and delay the initial desire to void. Beta-3 agonists activate beta-3 adrenergic receptors in the bladder to relax the detrusor smooth muscle and increase bladder capacity. It's important to talk to patients about the available medication options and to work with patients to determine which medication may be best suited for them. If one medication doesn't work, that doesn't mean none will. In my practice, I've had success prescribing beta-3 agonists, and today I'd like to discuss the clinical attributes of one beta-3 agonist, in particular, GEMTESA.
GEMTESA is the first and only beta-3 agonist that has efficacy data supporting relief from all three key OAB symptoms in its label.
That's correct. In the EMPOWER pivotal trial, patients treated with GEMTESA saw statistically significant reductions in frequency, urgency, and urgency urinary incontinence at 12 weeks, and reductions in OAB symptoms persisted to 52 weeks as assessed in the EMPOWER open-label extension trial. Let's not forget it's the first and only beta-3 agonist approved for the treatment of OAB in men being pharmacologically treated for BPH. Recent results from the COURAGE trial demonstrated a reduction in average daily urgency episodes, average daily micturition frequency, and average daily urgency incontinence episodes in men on pharmacological treatment for BPH.
Beta-3 agonists are generally well tolerated, but the AUA guidelines do outline concern about the potential effect of beta-3 agonists on cardiac function, including hypertension. Contributing to this concern is the fact that the prevalence of both OAB and hypertension increase with age.
But GEMTESA has no blood pressure warning in its label, right?
Yeah, you're correct, man. GEMTESA is the first and only beta-3 agonist with no clinically significant impact on hypertension or blood pressure. Note that in the COURAGE clinical trial of men being pharmacologically treated for BPH, the rate of hypertension was 9.0% among 553 patients given GEMTESA versus 8.3% among 551 patients given placebo. In the EMPOWER pivotal trial, the incidence of hypertension was comparable between the GEMTESA and placebo arms, 1.7% in both groups. The proportion of patients with increases in blood pressure were similar between the GEMTESA and placebo groups as well, 0.7% and 0.9% respectively. In a 4-week randomized placebo-controlled ambulatory blood pressure study in 200 patients with OAB, treatment with GEMTESA was not associated with clinically significant changes in blood pressure.
Beta-3 agonists may interact with CYP2D6 substrates, which is an important consideration when choosing pharmacotherapy. Annually, patients with OAB take an average of 12 to 14 medications, many of which are metabolized through CYP2D6. 79.3% of patients taking any OAB medication also take medications metabolized through CYP2D6 pathway. which is why it's so meaningful that GEMTESA has no interaction with CYP2D6 substrates. However, note that concomitant use of GEMTESA increases digoxin maximal concentration and systemic exposure as assessed by area under the concentration time curve. Serum digoxin concentrations should be monitored before initiating and during therapy with GEMTESA and used for titration of digoxin dose to obtain the desired clinical effect. Continue to monitor digoxin concentrations upon discontinuation of GEMTESA and adjust digoxin dose as needed.
So in summary, GEMTESA is the only beta-3 agonist approved to treat all 3 key OAB symptoms and the first and only beta-3 agonist approved for the treatment of OAB in men being pharmacologically treated for BPH. GEMTESA has no blood pressure warning in its label. GEMTESA does not affect the CYP2D6 enzyme. Please continue watching for additional important safety information for GEMTESA. And be sure to watch the other videos in this series to learn more about GEMTESA and the Empower and Courage clinical trials.
Indications and usage. GEMTESA is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. GEMTESA is contraindicated in patients with known hypersensitivity to vibegron or any components of GEMTESA. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking GEMTESA. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue GEMTESA in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with GEMTESA. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue GEMTESA and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with GEMTESA were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.